So I'm going to talk to you guys about heated high flow oxygen. First off, what is it? So heated high flow allows heated air and extra humidity to be added to the oxygen administration. It consists of high flow gas with a fraction of inspired oxygen ranging from 0.21 to 1, or to nearly 1. It is adjusted by an oxygen blender. It's brought to the body's temperature and saturated with water through an inline humidifier. It is typically used in hospitalized patients. The purpose of it, it improves functional residual capacity by reducing the work of breathing. It enhances patient comfort, delivers a flow rate up to 8 liters per minute in infants and 60 liters per minute in adults. It facilitates secretion removal. It avoids epithelial injury, reduces, and it overall reduces work of breathing. Some contraindications we have would be aspiration, preclusion of the nasal cannula or upper airway obstruction, decreased level of consciousness, trauma or surgery, pneumothorax, and other complications include abdominal distension, pressure areas, and possibly hypotension. So some parent education. We want to let them know that they should not feed the child during the initial 2 hours of therapy. Oral and nasal care must be performed every 4 hours. Educate them on signs of aspiration, such as coughing, difficulty breathing, shortness of breath, or wheezing, and educate on hypoxemia, which is a low blood oxygen. And in order to know that, like at home, they could easily just check their O2 saturation. We want to educate on appropriate positioning to maximize oxygenation, so such as elevating the head of the bed 30 degrees at least, or having their kids sit up in bed, or pretty much sit up in the Fowler position is the best to promote oxygenation. So some nursing responsibilities. So we want to make sure that the device setting is matching the order. We want to secure nasal cannula on patient, so ensure the prongs sit onto the nares and not completely occupy the nares. Once the flow rate has been reached, assess for the need of supplemental oxygen. We want to monitor their O2 saturations and their heart rate continuously. We want to observe for signs of distress and abdominal distension. Stabilization should be observed once the heart rate and respirations are reduced by 20% or within defined limits. And then we want to assess for pressure areas where the prongs are sitting on the nares. Thanks for listening.